Well, Intermountain Healthcare says they are seeing too many people show up at hospitals and clinics thinking they might have COVID-19.
Now, they worry that this could actually cripple the healthcare system if it doesn't stop. Fox 13's Lauren Steinbrecher joins us now live from Intermountain Medical Center with more on that part of the story. Lauren.
Yeah, Emmy and Max. So we're in one of the hospital rooms near the ER where they say people are coming in, a huge surge of people into the hospital who are not sick or don't have symptoms of COVID-19. Now, Intermountain Healthcare says they are changing the process of how they screen patients with some of those respiratory symptoms that are from COVID-19, and they are making sure they have enough staff on hand to handle that surge, but they don't want people to panic and rush into their emergency rooms and clinics because they say that's going to overwhelm the healthcare system. It's not going to allow those people who really are sick to get that help. So they suggest staying home first, making sure you're isolating from your family, making sure you're not going into work. But there are things you can do if you're not even feeling sick at all.
So what can you do if you don't have symptoms? How can you help us as healthcare professionals, and how can you help your community? The thing we need to focus on right now is that our life is going to change for a little bit. Our life is going to be disrupted, and we are going to be disrupted because we need to focus on the health of the community. We are asking people to limit social gatherings, especially those gatherings that are greater than 100 people. We want people to avoid going to social gatherings to mitigate the transmission of the virus. So that's not going to restaurants. That may not be going to concerts or church services. We are doing this to protect our population and our community. We are in this for the next 4 to 8 weeks. Most likely, based on the previous country's experience with this, we will likely be having to do this social distancing for maybe up to 2 to 3 months. But this is a small price we have to pay to protect our community and keep ourselves safe. So what can you do?
Right now, Intermountain says we are not seeing community transmission of coronavirus COVID-19. That risk is currently low, but they anticipate that could rise in the days or weeks. As you heard, we could be in this for the next 4 to 8 weeks. So they stress the importance. Instead of coming in here to the doctor's office, the best bet is to get on your phone if you feel like you're getting sick, or get online and get resources there. Only coming in if you're extremely ill or in that especially vulnerable elderly population. Live in Murray, Lauren Steinbrecher, Fox 13 News, Utah.